my humble pronouns at the lotus feet of our dearest Mother Sai. My humble pronouns at the lotus feet of Antaryami Sai, present in all of you. Thank you so much for this wonderful opportunity. And there is a disclaimer. We have decided not to have any videos because we had enough of videos. So just to give a break to your eyes, we are not going to project any videos. It's going to be just a heart-to-heart conversation. So through this medical mission, we have portrayed how many patients we served and things like that. So we kind of reflected on ourselves through the lenses of Sai, service, adoration, illumination, what it did to us. That is a very important aspect of our own internal journey. So that's what we are going to focus on with this panel. And just to recap our medical mission, it is based on 5 pillars. Universal healthcare. Our dearest Mother Sai is always passionate about universal healthcare. That is healthcare to all the corners of the world. So through taking that into heart, we're working really hard to take this medical mission to all parts of the world through telehealth, mobile clinics. We are still working towards that progress. So I'm going to just touch a little bit upon all those aspects due to the time constraint. So free healthcare, you all witness how many medical camps and international disaster medical camps has been conducted as well. And Swami reiterate, it's not just the universal healthcare and free healthcare. It has to be a compassionate healthcare. It has to be done with love and compassion. So that's what we are going to focus on through this panel discussion. And it has to be comprehensive healthcare. Comprehensive in the sense, body, mind, and spirit. So Swami has given us beautiful tools. And the 5 human values are the prescription to practice the comprehensive way of medical care. And also, a Divine Mother reiterates on the preventive healthcare. So that means prevention is better than cure. We all know that. And talking about this in Kenya and Africa as such, there are so many diseases that can be prevented in Africa by conducting so many medical camps, which Dr. Sunil is working really hard with the international medical team to bring about changes in Africa as well. And just to give an update on the latest data about the malaria death is 580,000 children under the age of 5, they die because of lack of medicine for malaria. It is really saddening to even hear that. And in the past 2 years, we have been doing the medical campaign last year in Nigeria and Benin. Every other child had malaria. If we had not been there, the child would have died. So that prevalent that malaria is, and we really have to work very hard. And with the medical mission, it's not just the doctors. 10 of us can go and do magic. We need non-medical volunteers as well. So we really request all of you to put your heart and soul, think about it, how we can improve and conduct many more medical camps in every part of the world so that we can prevent diseases, which is very dear and near to our Mother Sai. So with that, let's go to the panel discussion. The first question I wanted to ask Dr. Sunil. Thank you so much, Dr. Sunil, for joining us. So can you please talk about the Sai Medical Clinic that is being conducted in different parts in Africa?
Sairam panel members, Sairam everyone. My humble pranams at the lotus feet of our beloved Bhagavan, Sri Sathya Sai Baba. Sister, in Africa, there are 19 countries under the SSSIO, of which medical activities are taking place in 10 countries. Out of the 10 countries, 5 of them have permanent clinics. So the permanent clinics are, number 1, in Kenya. Kenya has a full-time permanent clinic which operates 5 times a week, which has medical and dental facilities and treats hundreds of patients every day. We then move on to Tanzania. After our recent international medical camp in April, Brother Krishnan, the NCP of Tanzania, was inspired to start a permanent mobile blood pressure clinic. And It is in its pilot stage now. Along with that, we also have the opportunity to start a dental clinic, which is at its advanced stage. We have ordered the chair and we are now sourcing the accessories. From Tanzania, we move on to Madagascar. There is a long-standing medical clinic in Madagascar, which is being run by Brother Krishna Rambajan and his team. They have a medical clinic that operates twice a week. Apart from that, they provide powdered milk to malnourished children. And they also provide or offer financial support to patients who need treatment at bigger hospitals like surgeries and other things. From there, we move on to Botswana, where I come from. Botswana has been having a full-time medical clinic operating every Sunday from the past 17 years. It offers medical, dental, eye, pharmacy, ultrasound, and physiotherapy services. The clinic has been operational in all the 17 years, every Sunday non-stop. A standout point of that clinic is we have a paperless system from patient registration to dispensing medication. Apart from that, we also have an SMS system because when we first started this clinic, patients used to queue from 4 a.m. in the morning. In winter, it's very cold and it's sometimes minus degrees. And many of them would go back disappointed because we couldn't cater for more than 100 patients at a time. After we started using this SMS system, patients can now send an SMS at 5 a.m. and if they get an acknowledgement and a token number, they can come at 9 o'clock to see the doctors. This has proved to be very effective in patient volume control and helping us to treat the patients more efficiently. From Botswana, we move on to Benin. In Benin, after our international medical camps, which you were all part of last year, where we went from Nigeria to Benin, we found that most adult populations suffer from malignant hypertension. Malignant hypertension is a condition where the blood pressure is over 180 by 120. They can end up having a stroke or a heart attack at any time, as you are aware. So, upon inquiries, we noticed that most patients have a genetic condition causing high blood pressure, and at the same time, they default on medication because they simply cannot afford. So, after that, with efforts from our International Medical Committee Chairman, Dr. Dinesh, and our IMC Secretary, Sister Urvi, and Brother Fego, the NCP for Benin, I'm glad to inform you that we started an international blood pressure clinic in Benin. Apart from that, we also do blood sugar testing. The main thing is patients now come bi-monthly and they collect their medication like every 3 months. It means they will keep rotating every 3 months. And everybody is happy. After 3 months of its effectiveness, we see that most people are now going back to work because they have become productive and they can support their families. In summary, sister, our clinics not only provide essential medical services, but we also identify the challenges in each region and tailor-make the services accordingly. Thank you.
Thank you so much. This wonderful evidence report. And I would like to know, would you please share the impact at the personal level and the community level? What's the transformation you notice after the medical camps? Any awareness about that?
Thank you. I'll keep it brief because time is short. The impact varies from country to country. For example, when you look at the permanent clinics and the medical camps, the assurance that people get that this clinic is there makes them happy and confident and comfortable. When it comes to the blood donation camps, the impact of these camps is immediate and life-saving. I'll give you the example of Mauritius. In Mauritius, they do a bi-weekly blood donation camp, which can collect up to 100 pints each time. And they do a twice a year mega blood donation camp, which can collect up to 500 pints each time. This is huge. This liquid love is huge. And Mauritius has received numerous presidential awards because of this activity. Similar activities of the kind are also done in Malawi, Botswana, and South Africa. We also look at primary prevention. Primary prevention is to educate people so that they don't suffer or get more critical illnesses. We do that in the form of health education, postures, lectures, and other audio-visual equipment.
Thank you so much, Dr. Sunil. It's hearing your thoughts, and there's a lot more work to be done in Africa. My dear Mother's Race and your guidance and your leadership, we can accomplish that. Thank you so much. Next, the panelist, Dr. Raju. Sairam, Dr. Raju, thank you so much for joining us. So you have attended many international and you're conducting so many medical camps in the USA as well.
Yes.
And you collaborate with the community so beautifully, not just the Sai doctors, you integrate the local community, public health. Could you please elaborate on that?
Loving Sairam to all of you who are present here. And with immense gratitude to Bhagwan, who has sown that seed of service. It dates back to Prashanthi Nilayam, the medical camps, sister. So which went on till 2019 under the tutelage of Bhagwan, wherein we used to sit in the darshan, where Radha Bhattina and Dr. Sarojini, these people along with which I started my journey in Prashanthi, Swami used to ask how many people have come, where are you sitting, what time you are going to start your medical camp. He used to look at the Rahu column. In other words, what is an auspicious time? Despite he is the navigator, you know. So, and that's how the journey used to start. And he sent us and taught few things by working in the hospital there itself and going to the villages, and wherein he used to monitor at what time we should go and what time you come back. And he told at that time, I'll send you in a bus, which is right now, I think, is going into the villages and it is taken by leaps and bounds. That's what brother is talking about, setting up a blood pressure mobile camp. I think that's offshoot of that. Now I see that what Swami meant. And during that period of time, so Swami used to watch so closely when he has sent us to the schools also, his schools wherein we did the physicals. So under his tutelage, when we picked up that, then it came to our international medical camps, wherein I'm just trying to recap how we got that energy from, and the source is the force, is Bhagwan, no one else. He's the one who creates a scenario. He's the one who puts the hurdle. He's the one who solves, and he's the one who gives the joy, saying that you have done it. So in that context, so there were few international medical camps. I would like to share a couple of incidences which are going to be catchy rather than telling those numbers and figures. So we had been to Haiti when there was an earthquake. There were several aftershocks which were there. And in Guyana, we had been to several medical camps under the direction of Swami itself. And brothers told about Nigeria and Benin. So under the tutelage of close monitoring of Dr. Narendra Reddy and Samsiva Ragaru, who happened to be also in these medical camps. In Haiti, I want to make just a mention of the incidents. So we were serving ourselves in a big church and a small church. There was a huge crowd that is there. They don't have water. And with these aftershocks, they were all under frenzy state, not able to sleep, not having clothes, not able to drink any water. Suddenly, they brought one patient who's totally pale. And when I looked at it, there's no pulse. I thought this guy is going to collapse right then and there itself. Then intensely, I called for Swami Arthatrana Parayanaya Namaha. We chant those 108 names, right? Those who are in distress, he comes right away. And there's a young man with a walkie-talkie putting on himself goggles, and he keeps jumping and he rolls into the church. Then I said, can I use your car? He said, yes. So along with him, he took us there. There, Mount Sinai Hospital was conducting a huge medical camp of all these critically ill patients. A day before, I think during the earthquake, there's a huge building which fell down where 200 people was buried just alive there. So in that area where we took this guy, and he's having a hemoglobin of 4, very low, and they transfused, and the patient survived. This is not the first time Bhagwan has done. At every person's personal life, every person's medical camp, whether it is here or elsewhere, he comes to the rescue. That is what has derived that energy, and that's what has motivated, and that's what has brought me up to this level. And one more thing, sister, with your kind permission, I want to tell about Shanti. There, the medical camps were happening. So in 2010, that's when Swami's 85th birthday was there. Almost 10,000 patients were pouring in. And I have met several of people over there from all the countries where we were doing the medical camps. Suddenly the students have brought the ex-principal there who passed out. And we brought him into our acute care, and we looked at it. He's having VTAC, which is a fatal rhythm with which he can die then and there self. Swami, please save me, not this time, not here, not in your heavenly abode, please. So then we are intensely praying, and we brought our ambulance. There was a lot of crowd. You can't even get out. You know, during birthday times, how heavy the rush is. Swami made sure that he's wheeled up all the way up to the ICU, and they gave a shock, and he got back to normal rhythm, and he did very well. Swami is the motivator. Swami is the healer. This is all, whatever that we are planning is because of his divine and a bigger plan in which he put all of us as instruments. We are navigating through this whole process. I think I gone overboard, I suppose.
Thank you so much for sharing that, brother. I think we all feel the divine hand working through all of us. But through this time, it's not our degree or our achievement that matters. It is our surrender and faith. Thank you so much for sharing that. Next, Sister Neelam. Thank you for joining us, Dr. Neelam. So you also do a lot of medical camps involved in the community. I'm very interested in how do you involve the community? Because even in African medical camp, we collaborated with the local hospitals. Sometimes even Russian medical camps, we collaborate with the local community. So could you please explain how it's important to collaborate with the local community and know the culture?
Sairam. So yes, it's with every medical camp, we should know what's happening around that area. And so we start with going out into that community and finding out what the needs are. After finding out the needs, then we find out what resources we have as the organization and what resources we would need. So oftentimes we may not have enough physicians or enough dentists or ophthalmologists. So we'll go out to the community and let them know that we would like to do this medical camp in your own community. Would you like to participate? So to tell a quick story, we had a medical camp in a place called Oxnard, California, which is an area that's underserved, and there's a lot of migrant workers there. And they speak mostly Spanish. So we had reached out to the community and reached out to a couple of doctors. And a doctor said, okay, well, I'll come to the camp and see what this camp is about, and I'll participate. And he came with his wife, who also speaks Spanish, so can interpret for him. He came for the camp. He saw the camp, saw all the good work. He came at the beginning of the camp. During lunchtime, we had to tell him, please go to lunch. He said, no, one more patient. No, please go to lunch. No, one more patient. Lunch is going to close. So we had to send him for lunch. He comes back and he stays, and he's the last physician to leave. And he was so inspired by the camp and the work there that he wanted to come back the next year. So the next year when he came back, he brought 2 more physicians from his own practice. And so now we're involving more of the community through his inspiration. I was inspired by him as well. And again, the same thing happened. He won't go to lunch. He came first, and he left last. Following a couple of years later, he brings his son, who had recently graduated from his residency program. So like that, with involving the community, not only are we inspired by their work, but they're inspired by what they see around. And so that's how we should go out to the community and bring them along with us.
Thank you so much for sharing that. A very similar incident happened in Des Moines when we did the medical camp also. So she's a local American optometrist. She came for our medical camp, and so she has never done any voluntary work. So the very first patient, as soon as she gave the glass, she was in tears. She thought, I can never see it. I thought I can never see in my lifetime. And she started hugging the doctor and cried. This doctor started crying. And for the past 12 years, she's not a Sai member, but she attends every time before she leaves. When is the next medical camp? She put me in. She just puts her name in before even she leaves the premises. So that's the transformation we see in the community as well. Thank you so much for sharing. Any other personal Swami moment have you experienced, or any of the devotees shared with you?
Sure. So there was one devotee that shared this experience with me, that he had he works in a hospital, and from his hospital, one of his colleagues, he asked them if they would like to participate in the camp, and they said sure, and they speak Spanish, so she said she'll come to interpret and bring her 2 daughters. So so they're all set to come to the camp. The camp is started, and the devotee gets a phone call from these 3 individuals and says that we can't make it because there's a family emergency. So now we've lost 3 interpreters, and interpreters are very important for the medical camp. And as soon as he hangs up the phone, 3 individuals come walking towards him. He doesn't know how they got there. He doesn't know how they found out about the medical camp. But they said, came up to him and said, we would like to participate in the camp, and we speak Spanish. And so Swami didn't even give him a second to think that what am I going to do without having these 3 interpreters. He's the doer. He brought the interpreters to him.
Beautiful. Thank you so much. Swami puts through the trouble, and he manifests in different forms. So that's the experience we get to experience when we go to this camp. Thank you so much for sharing the beautiful.
Thank you, Dr. Ramadevi. So you've also participated in many camps around the world. And can you share one instance where you felt that Swami was the doer?
Yeah. So let me recollect one of the incidents. Haiti was my first international disaster medical camp. Even though it happened in 2010, seems like it happened just yesterday to me. Every moment was a Sai moment during that camp. So one day, it was a Thursday morning, around 8:30, a lady, she was holding a baby, a 15 or 18 months old baby. She was rushing into the church, crying because the baby was having a seizure. So that was the first international camp. I was like literally shivering. Swami, this baby, we have to save this baby. But this is the first medical camp I'm doing. I don't want anything to happen to this baby, because any emergency, we have to send the baby to the local hospital. So I was praying intensely, and then we all ran, and then the cardiologist, the internist, we were all running behind the baby. We went in and then took the baby to a private place. The baby was laying down. I just put my hand and chanted Sai Gayatri. First, let me invoke Swami before I do any medicine. My mind couldn't even think at that moment. We think that, yes, I did pediatrics in India and US, and I have this and that. But at that moment, it is only the divine hand that operates. But then, before even I completed Sai Gayatri, the seizure completely stopped. And this child did not even have a fever. It was not a febrile seizure. And this child did not have any post-ictal phase. Normally, any child with a seizure, they'll just become limp and they sleep, and then they will have involuntary bladder or bowel movement. None of those. This child just sat up like this as if nothing had happened. And we were all witnessing how the divine hand comes. And it is not that I'm going to help it. It was a very humbling moment for me. And I learned it's not just go with faith, surrender, and humility. And I think that's exactly was talked about this morning about service. What are the qualifications for service? Is the humility and surrender. All those qualifications, Swami taught that in the very first medical camp itself. So ever since then, Swami, it's not me going, it's you. Please take me this instrument and do whatever, let your will and your wish prevail. So that's the humility Swami is always teaching us.
That's very nice thing that you have mentioned, Rama and Neelam and Dr. This thing. I just wanted to mention, it's not all about doctors who are conducting the camps. What I wanted to bring to the kind attention of everyone is these things are happening because of the volunteers. They are the main pillars of any medical camp, which we were discussing yesterday. So it's all about, medical camp is all about the back pillars, it's all about the devotees who are becoming, or non-devotees who are coming and participating. And then since we talked about in the service, how can we involve the community is, I think, getting more volunteers into this, and so that they get to know this service is happening. So they'll jump in and come, whether it is a fellow physicians or anyone else coming from in other sectors also. It just speaks a long way in trying to strengthen this further and taking this mission to the next level, in which Swami's vision, right, as initially you mentioned, on all those 4 pillars, I think it moves forward without any iota of doubt.
And it's also one of the beautiful way of community outreach. So that's also part of the Sai 100. So when the other people from outside, when they come and do the service, they experience the love. So that's what that pulls them. And then they wanted to know more about Swami. We are not going that they come voluntarily after that. So it's a beautiful transformation. It's a mutual learning process, which also humbles us.
Yes. Speaking of the community, sir, go ahead.
That's yes.
Okay. I would also like to take this opportunity to request all the senior office bearers to motivate the young adults in your country to join our both medical volunteers as well as non-medical volunteers to join in our medical missions, so that we can take Swami's message forward in a sustainable manner.
Kindly reach out to the central president, your medical director, zone medical director, and the zone chair, so we can create a database so that we are self-sufficient, as well as we can involve more people as well. And
speaking of the community, right, we assess the community needs wherever they are. For example, here when we went to Nigeria and Benin, the malaria is an issue, which you mentioned, those staggering statistics. I would just wanted to narrate one incident which was really striking, which really brought a big transformation. South America, we happened to go to one of the medical camps where Hector Castaneda and these people were there. There's a child who came with not able to breathe well, and immediately that child was transferred to the local hospital. So
yes.
Next day, Rama and myself with the rest of the medical director, we happened to visit the hospital. It took a while. I said, we have to go and see the child. So he had a tracheostomy because he's not able to breathe. So they made a hole here, and the child was kept in the hospital. Only thing was, they were not having the suction operators like it come in hospital. So immediately all of us felt that we should get a suction machine and leave it with them. So that happened. That's not where it ends. Swami, how he closes, just 3-4 days before, that medical director sends me a picture of the child who's just like a budding rose, and this hole is closed, and he is totally healed from whatever is the reason he was not able to breathe. And wherein our intervention, Swami gives these opportunities, not now when. This is to transform ourselves to reach to that next level, if not now, when, brothers. That's where I want to say.
Do we have time for one last question? So the human values is the foundation of the Swami's teachings. And you work with the SSEHV. How do you integrate SSEHV, which is the Sathya Sai Education of Human Values, in the medical sector, the medical practice?
No, thank you for asking that question. Sathya Sai Education Human Values, I think it's the greatest gift Swami has given to humanity. And I'm very passionate about that. My goal is we have to take that to every nook and corner, and every human being should know this. And as a pediatrician, practically speaking, it's very practical. I literally prescribe human values to prevent mental illnesses. And it really, really, really works because it's very basic things, anxiety, depression, all those things, because there is a dis-ease between the mind and the conscience. So that is what is causing the agitation and anxiety, leading to depression and whatnot, all kind of chaos that's happening in the world. So how do you fix that dis-ease that comes with human values? Constantly integrating that awareness that we are that human values that beautifully transforms so many children, especially adolescents. So it is really, really important to integrate human values, not only just the patient perspective, it also helps the physician, because physician burnout or healthcare burnout is a big buzzword, because when we don't practice with love or compassion, then we are definitely going to be burnt out. And the love and the compassion, it energizes us rather than draining our energy. So human values, it's mutually beneficial, both for healthcare workers as well as for our patients.
Brother Sunil, I just have a question for you. As Suresh Govind is here, he's talking about Sai 100 in that, right? This is what they wanted to do, 1,000 medical camps, X number of medical camps. I think Africa, in which the magnitude of the problem with which it's going on. So where do you see with that Sai 100, how we can take and reach that goal of those number of medical camps? Do you agree that you have enough potential here?
Saira, there is definitely a lot of potential to help Africa. Let us all join hands together and do that. We can definitely achieve our target.
Simple malaria, I just wanted to bring one issue where Swami personally took so much interest. I can't resist talking about this. I visited General Hospital wherein the dengue fever was to the fullest extent, that is caused by the mosquito itself, and wherein Swami personally supervised, and he started a project during that period of time, and wherein going and spraying in each village so that the dengue fever can go, as though that he cannot wipe it out just with the whiff of his hand. So he supervised that, wherein again, here also there is a similar malaria issue there, wherein it has a large magnitude, and in the form of, they were talking about mosquito nets that they were giving it in the past, and in various ways. I think this is a simple problem, but it's a major problem. This is at the grassroots level. If this can be handled, I think that will be one of the biggest things that we can do in this country. I think Swami has brought us to this place is to take care of that magnitude of the problems that this country has it. And from this, we can learn and emulate things and spread the message, whichever zone we belong to.
Yeah. Thank you. Thank you so much. If you have any questions or if you want detailed reports, we didn't present any statistics, you can always visit sathyaSai.org. And Eternal Companion has a lot of detailed articles about medical camps. If you're interested, please visit those websites. You can always reach out to us anytime. If you wanted to volunteer, kindly reach out to us so we can discuss and we can collaborate and work together. So with that, I think thank you so much for this wonderful opportunity. And I would like to thank Brother Rao for taking this so much of effort, doing the 3-country medical camp just 2.5 months ago. That's a mega project. And then within 2 months, having this international conference, just with the faith and surrender, I think he did it. It is with such a humility, he did it. So it's a learning experience. I was like, wow, that's a learning experience and biggest leadership. I really commend on him as well. Yeah. Thank you so much.